So my name is Professor Sandra Turner. I'm a radiation oncologist at Westmead Hospital. I've worked there for nearly 30 years now, and I've had many roles at the college as a volunteer. In particular, I was the founding lead of the Targeting Cancer campaign, which raises awareness of radiation therapy as a very useful and safe, effective treatment for cancer. So sarcomas are a very rare type of cancer, and there's a whole group of them depending on where they arise in the body. They tend to be divided into bone sarcomas, obviously arising in bones of the body, and soft tissue sarcomas, which arise in all connective tissues in any part of the body. So that could mean in fat, muscle, cartilage, nerve, and all the other soft tissues that construct the structure of our bodies. So radiation therapy plays a very important role in treating many sarcomas, particularly those occurring in the limbs, the arms and the legs, and also sometimes those in the abdomen. In the limbs, you use radiation therapy to either mop up cells after the surgeon has removed the main lump, or often more these days before surgery, to reduce the chance of there being any tiny cells left behind when the surgeon removes the main lump. And in this way, the radiation can actually improve the results after surgery and improve the function of the body parts. So, for instance, in the old days, we might have used to have amputated, removed a limb in order to cure a cancer. Now we can use radiation and less extensive surgery to maintain a really useful functioning limb. So I've treated many patients for sarcoma over the last few years, and I think the striking thing about them is that they're often young people. They often have this shock diagnosis of something which completely throws their life. And they go through this process of often a long course of radiation therapy for 5 weeks. And then a few weeks after that, quite major surgery and sometimes also chemotherapy treatment. And this obviously takes a long time out of their normal work and family lives and can be a very, very challenging time for them. But the stories of amazing recovery and getting back to normal family life are really inspirational. So, for instance, Ben Lee was a patient of mine who had a very large sarcoma in his lower limb, his leg, went through 5 weeks of radiation therapy, surgery, chemotherapy, a long course of recovery and getting his leg back to normal. And now he's seriously bike riding, he's raising money, he's made a lot of money to actually help research into sarcoma in the future. He's got on with his life, but not only that, he's making a difference for all other future patients with sarcoma.